the way that biological, if you were born with a vagina, an artificial vagina creating a vagina is not going to function in the same way that, a God-given vagina would. The same thing with male anatomy. You can be a biological female and we can deconstruct your vagina and we can rebuild something artificial in the way of a penis, but it will never function the way God intended a biological male to function. There will always have to be some sort of enhancement, which then subjects you to further surgery because that's generally a mechanical device. And when you talk about mechanical devices, much like heart pacemakers and heart valves and things like that, at some point in time, all or part of that device is going to need to be replaced. Not to mention if there are complications with the original surgery. So God forbid you have complications with the original surgery, you may not even get to the point of having a prosthetic implanted, because once you go through surgery and once you take a step back and start hormonal manipulation, you're a patient for life. And that's where the greed comes in, because this sort of hormonal manipulation creates patients for life. Once you start that hormonal manipulation, even if you decide to go back to your original God-given form, you're going to be on hormonal enhancements to supplement what you lost going through that transition to begin with. So if you were a male and you tried to become a female and you go back, you are generally always going to be on testosterone because you will have killed your testosterone stores or significantly depleted them such that you're not going to have your normal amounts of testosterone that God intended. So that's where the greed comes in. The hormonal manipulation and the surgeries basically create patients for life.